We have got a really special skincare today, and I'm with the lovely Rachel.
I'm a nurse specialist at breast cancer now, and I've been a nurse for 30 plus years.
Yeah.
So I've been working at breast cancer now as a nurse specialist for many years, working with women with breast cancer.
There are many women who always say, what can I use? Because I'm going through a process of chemo, radiotherapy, my skin's sensitive. So there's definitely that lady that we would love to be talking to today. Also, people generally who have very sensitive skin and just want nurturing. And we've got a whole list of things. We have Jess on our team who's researched like mad all the amazing brands that offer things specially for women who are going to hospital to have chemo or, you know, just going through treatments. I think this might apply to anyone who's going through quite a lot of illness. It will depend on skin sensitivity, so we focused it on that. And we've got a lot of questions too. I'm just going to literally start. How can I reduce the dark discoloration on my breast from radiation? Is that a common occurrence?
It is.
It is, okay.
I think it's difficult because it takes time for the skin to settle down. I mean, maybe using an oil of some type. I mean, certainly on the scar, that's always a good thing to do. Because constantly checking your breast or your scar by putting that oil or cream on.
Okay.
There's no specific.
All right. So, I mean,
but it may fade over time.
It may fade over time. Okay. Why do oncologists say HRT causes breast cancer? That's a big one.
I mean, in terms of when you've had a diagnosis of breast cancer, you can't then, on the whole, take HRT. Yeah. Because most breast cancers are driven by the hormone estrogen. Yeah. So we tend to avoid it. Yeah. There is, for those people who haven't had breast cancer, there is a small risk by taking HRT of breast cancer. But it's small when you think about things like weight gain as you get older and that being a risk factor, when you think about alcohol and that being a risk factor. I mean, when you
think about, there's a lot of stats on HRT that it's a far bigger effect on the heart than it is on breast cancer. I mean, I just think there are, I think it's weighing up. So that those are two different questions in a way. There's two different questions because one is, you know, should I be scared of doing HRT because I might get breast cancer? I think, you know, let's say your mother had breast cancer under the age of 50 and you have breast cancer in the family, you might question yourself more. And if you've had none,
it's about balance.
It's about balance. I mean, I wouldn't, you know, from my own perspective, my mother had breast cancer and she was over 50 and I didn't hesitate about HRT and it changed totally my life.
Absolutely.
So it's a very personal choice.
Yes,
and different doctors will say different things because I have a doctor in America who says not all breast cancers are triggered by hormone releases, 1 or 2 which are standalones, but you have to really believe and understand that too. Yeah. Okay, so it's a open-ended answer.
Yes.
When will it be safe to use retinol again if you've gone through chemo? I
mean, I think, again, it's about how your skin is because I'm sure that you will talk about this all the time about retinol. Retinol is a really difficult product to use because it can make your skin really sensitive and using it in a step-by-step process. So I think it's probably about seeing how your skin is.
The skin changes in many different ways, dry to oily and vice versa. So what once worked may need changing up. What ingredients look for in a product? So do you think that question is as a result of chemo? Because I think you can get, what I've had lots of women when I make them up and they have chemo skin, so it's it feels thin and papery and that's the drugs,
Yeah, that and the side effects of the treatment, so the menopause and all the things that come along with the menopause.
Does everyone, can I ask you, this sounds absolutely quick question because I don't know this, but if you do chemo for breast cancer, do you all have to, does everyone go into menopause?
You might go into a temporary menopause. Yeah. Depends how old you are. Okay. If you're on treatment such as hormone therapy, then you're very likely to experience menopausal symptoms. All right. So most people will have some.
So in a way, those skin symptoms they're seeing are as a result of having had to go into menopause early and what you might maybe see trigger down the road.
Yeah, so some of it will be related to the chemotherapy.
To the chemotherapy, because that can dry skin out. Can I ask you, post-chemo and post-treatment, can people go on HRT or not?
No.
They can't, okay.
On the whole.
On the whole.
It's not completely no, but it would be something that an oncologist would need to be involved in.
So it's looking at other things that can help because I'm thinking of skin and what I do for skin. So, you know, I have a very strong treatment I get from America, which includes injecting peptides. So it would be interesting. When I'm in America, I might have a chat with Dr. Eric Schwartz, who wrote The Hormone Solution, because peptides to me they're like the blockchains to create collagen. And when we go through menopause, we lose collagen. So I'm really interested to know where that treatment's going and how it can help. Okay, a few more questions. Is it normal that I am now more sensitive to the smell of a product? Yeah?
Yeah, I mean, taste, smell, all of those things change.
Okay.
It's usually temporary. And certain smells will trigger memory of treatment.
Oh, do they? Like
so,
a sort of totally domestic smell, butter,
yeah.
chocolate.
And maybe when you've been going through treatment, you've been drinking, I don't know, mint tea.
Yeah.
And then suddenly that smell will trigger what you have been through. So those sorts of smells can be evocative, as we know.
What are the best ways to rehydrate the rest of my body, looking for a safer product to look after my dry skin? I mean, I would say, I'm going to say Moo is great. I would say that a lovely range that Jess found from our team is called the Trio Therapeutic Care, and this is extra sensitive cleansing and nourishing balm for extra sensitive skin, which I love that. And you're going to find that when you smell it, there is no fragrance whatsoever. Fragrance is obviously in the wrong quantity, one of the things that can really trigger sensitivity. And then there's a Trio Therapeutic extra sensitive deeply calming oil for itchy skin, which I think sounds a brilliant product. The balm is 48 and the oil is £55, and it's got apricot kernel, sunflower, peach kernel, calendula and rosehip. And this brand has actually been formulated for cancer patients. It's free from fragrance and essential oils. Extra sensitive skin range keeps things simple. Okay. Can I ask you something? Because I think medical care around the world is really different. So some people can be extra careful and some people can be adventurous. Like I know many people who sort of go to the odd, weird things in South America, and they do these kind of odd things to try and cure themselves when they feel they've hit a brick wall with traditional medicine. So I don't exclude them. I have a few friends who have gone down a weird route and they're with us still today when their doctors were thinking they shouldn't. But it's a very, very individual journey, isn't it? And it's one that we're not here to suggest at all which one, but I would say that prebiotics are very healthy, feed the skin, and if you're perhaps post-chemo, but they are, I mean, I just like Aurelia because I just think it's all about calming, restoring and renewing the skin without heavy-duty things. So Aurelia has a miracle cleanser. She has cell repair night oil, and this is like neroli lavender. So this is not for sensitive skin to fragrance because it's got essential oils in it, but it's just the most amazing. I'm going to show you the smell because it's just, sometimes I think it's about that pampering of yourself and doing a massage on your skin and doing things that really just make you feel, feel a woman. I'm going to say that word, absolutely. But feeling a woman and smelling things that smell feminine, and a garden and life and growing plants. Just all of that is a all over feeling of kind of healing yourself. Is there a gentle way I can scrub my face? I want to start exfoliate again, but I don't know where to start. So for me, this is, I don't know how often you get this, Rachel, but that feeling of that paperiness of skin, but dry. Maybe cell renewal is slower. Your
skin's dry and as you know, your skin changes.
Yeah.
And you trying to find what works for you now.
Yeah.
So many things change for a woman after a diagnosis of breast cancer, and trying to work out what to do with their skin on top of all of that
is
when everything's
been life-threatening, and then
lashes
it's about
are lost, eyebrows lost, hairs lost for many people. It's really difficult.
So then, where to start? Because I want to be able to give a solution. I think it is that listening to your skin. I think if you're post-treatment and all the kind of chemicals have left your body, it's a question of experimenting gently with different things. Yeah. So if your skin is dry from treatments and drugs, it needs food. So ceramides and omegas and vitamin E's, they're all nice, hydrating foods, different from a hyaluronic acid, which is just retaining water. We're talking dryness, not dehydration. So I would say that's a good, just that nurturing, and oils, I would say all good. At some stage, dead skin cells are going to come up because your skin's going to kind of come back to life. And then you do need to swash off dead skin cells. So when we go back to the concept of exfoliation, you know, physical granular exfoliation will mean you're not putting strong chemicals inside your body. So maybe a gentle apricot kernel, just that feeling you can have of polishing your skin. I think is a nice feeling to polish your skin. So I would consider that. And then maybe after a few months, a PHA is a very, very gentle acid exfoliant, and I'd avoid AHAs or BHAs, which are quite strong, but a PHA really is gentle, and it usually has glutathione in it, which is soft. And just listen to your skin. So, you know, do it every few days, listen to your skin, thinking, am I getting life back in my skin? If you think it is, gently get into that routine. So, thank you so much, Rachel, and it's always a joy talking to you. We have done a previous film too, Rachel and I, just about kind of
breast awareness, wasn't it?
Breast awareness, and you know, I don't know if Poppy shared with you that we had, you know, a woman who, for the first time afterwards, you know, she had never felt her breast correctly doing a breast check, and she did, and she found a lump, and she went, and she, you know, and all the stuff we've done all this month for that one woman, it's great because you kind of caught something, we caught something early. So if you'd like to feel that you, I mean, there are many places that you can understand how to feel your breast, but I now, since we had that chat, like knowing to put all my fingers together and do it in the same pattern and do it as a natural part of my day. So you can catch on Facebook or on YouTube, but thank you so much for coming in.
Pleasure.
All right, thank you everybody for watching. All right, bye-bye.